Norcross's office. We are here because we are demanding that he signs on to the Medicare for All Act of 2021. Last week, on March 17th, he put out a wonderful tweet in support of the new Medicare for All legislation. So it is to our surprise that he's yet to sign on to the Medicare for All Act of 2021, HR 1976. Tweets are great, but we need actions behind the words. So today we are out here with a powerful grassroots group of progressive groups, such as the New Jersey Working Families Alliance, South Jersey Progressive Democrats, South Jersey DSA, Our Revolution Gloucester County, putting the pressure on Donald Norcross to sign on to Medicare for All. What are we gonna do? We're gonna get Medicare for All. What do we need? Medicare for All. When do we need it? Now. What do we need? Medicare for All. When do we need it? Now. All right, my first guest is Sue Altman from the New Jersey Working Families Alliance. Come on here, Sue. All right, Sue.
Hello, everyone. Thank you so much for being here today. We are delighted. This is Sue Altman from New Jersey Working Families, and I am honored and delighted to be working in coalition with these incredible local and statewide organizers on the left. Our Revolution, South Jersey Progressive Democrats, and New Jersey Working Families, the United Healthcare Coalition, and so many more partners. This effort, the fact that we're even talking about Medicare for All as something that is a human right, means that the left and those who care and advocates and patients have been working so hard for years that this is even in the public conversation. It is incumbent on our Congressman, Donald Norcross, to support Medicare for All. This is a deep blue district. There is no reason why we shouldn't be pushing the most progressive, the most human-centric policies in the country right here in New Jersey District 1. We should be leading the charge on healthcare. We should be screaming from the rooftops in the midst of a pandemic that healthcare is a human right, that too long patients and family members have suffered, have seen bankruptcy, have seen their bank accounts dwindling because they can't pay for basic medical care. No more, not a minute longer. New Jersey Working Families believes in Medicare for All, and we will fight to the end to see this bill pass Congress. Thank you very much, and thank you to everyone here today.
All right, I just want to point to Donald Norcross's tweet from March 17th last week. The United States is the richest country in the world, but millions of Americans still can't afford healthcare. Medicare for All will change that. It's time for a bold change. Donald Norcross, this was last week. We need you to sign on to HR 1976. Please sign on today. Our next guest is Amir Khan from Camden.
All right, all right. This disgusts me that we even have to be here today. It disgusts me that here you have Donald Norcross, who's supposed to be representing us here in this region, and he's not. Medicaid is more statewide. Medicare is federal. Represent us in Washington. You know, I am known because of the activism work, but many people don't realize my business background in healthcare. When you look at healthcare, my dad was a doctor, mom a nurse, my brother's a doctor, sister's a nurse. We have a healthcare, very successful healthcare company here in New Jersey. If you look at the EOBs, this is all about profits. This is all about dollars and cents. If you look at the EOBs, the explanation of benefits on these bills, they're concerned because Medicare doesn't pay as much as commercial and private insurance. What they're doing is they're putting profits over the people. And I'm sick and tired of that. If anything, the people come first. The money will follow. What they're concerned about is Medicare is not going to pay as much as commercial. So what Donald Norcross does, who, by the way, sits on the board, several boards with his brother, George Norcross, and that's where they're making the money. I promise you, they're making more money from commercial and private insurances than they are from Medicare. That's what this is all about. They are putting profits over the people. And we're tired of it. We're sick as hell. And we're not going to take it anymore. We're saying, Donald, cut the line, the bloodline with your brother for once and all. Go to Washington, represent the people, represent us, and put the people over profits. Come on, everybody, yeah! Say people over profits! People over profits! People over profits, thank you.
People over profits! People over profits! People over profits! All right, next up is Kate Delaney from the South Jersey Progressive Democrats.
Hello, everyone. Kate Delaney, South Jersey Progressive Democrats. Excited to be here with so many fellow members of SJPD. And I'm going to pick up the refrain of my good friend Amir Khan, because this is really an issue of siblings, right? Of that Donald Norcross will not do the right thing for the public because it might be bad for his brother. So I'll offer an alternate sibling story. The reason I'm out here is because my younger sister was born with cystic fibrosis, a disease for which there's presently no cure. In Canada, the life expectancy for someone with cystic fibrosis is a little over 50 years. In our country, it's 10 years less. My daughter, back there hiding behind my friend Jim, has a mask because we wear our awareness for this disease literally with us every day. I have a tattoo on my arm about my sister's lung transplant. I watch my parents through my entire life get on the phone with insurance companies. I remember as a kid, my mom begging that she would pay the insurance company $1 a week, $5 a week, whatever it took. When my sister needed a transplant in 2018, one of the first questions that she was asked, or that we were asked, was an emergency, was did she have insurance? So no insurance, no lungs. Luckily, my sister had private insurance at the time, so she was able to get the transplant that saved her life. But these aren't decisions that people should make. So my sister, my sibling, is the reason I'm out here, because everyone should have health care. It is a human right. It should not be two brothers looking out for themselves and the bottom line. Thank you.
Thank you, Kate. Insurers deny, people die. Insurance deny, people die. Insurance deny, people die. Next guest is Roy Jones, Executive Director of the National Institute of Healthy and Humane Spaces. Roy, come on up.
I'm here today because I have a personal issue regarding health care for all. In 2020, my brother passed. He had comorbidities. He had multiple issues. He could not afford his prescriptions. He stressed himself to death because he could not get the prescriptions that he needed for his health care. So as an environmental justice activist, I am for Medicare for all. I am for Medicare for all. Another example, my wife went into the hospital at Cooper, and they told her, yes, you must get an operation by tonight. When they found out she did not have the quality of health care that they felt, insurance rather, they told her she had to leave. I made a decision to say we will not leave. She will get care. She will get an operation. So Medicare for all is important for all of us, especially people in the city of Camden who don't have the quality and the quality of Medicare that you find in other areas of the country. Medicare for all is a racial justice issue, and I stand firmly here to say that I am, and my organization is for Medicare for all. Thank you.
What do we want? Medicare for all. When do we want it? Now. What do we want? Medicare for all. When do we want it? Now. What do we want? Medicare for all. When do we want it? Now. All right, next up is Tom Notch from the Universal Healthcare Coalition of New Jersey, one of our main allies in this fight.
When we talk about healthcare, we want three things: simple, economical, and humane. Simple. Everybody in, nobody out. Everybody in, nobody out. Right now, today, we have 30 million uninsured. 10 million that lost insurance behind the pandemic, 17 million that are underinsured. A lot of people are out. No good. Simple. Everybody. Economical. Right now, we spend 25% on stuff that has nothing to do with healthcare. $700 billion every year that could be used. It's enough to cover everybody and expand the coverage that most insurance currently provides. So it's economical. Medicare for All is going to save us money and allow us to cover everybody. And finally, humane. The disparities that the pandemic has exposed are unconscionable. And it all comes because everybody doesn't have access to care. And that can be fixed too. In this district alone, there are 39,000 people, this congressional district, who do not have health insurance. So we simple, economical, humane. That's all we're asking. And anybody who wants to meet with Norcross, New Jersey Universal Healthcare, is putting together a delegation. I know some people have already met with him. And I have a sheet to sign up. And if anybody has ideas about new tactics we can use to move this bozo, I want to hear about them. So let's talk, okay?
Right, just so you all know, we have hundreds of signatures that we collected over the last 4 or 5 days, hundreds from people in the district who demand that Donald Norcross stand by his words and sign up to Medicare for All, HR 1976. Next up is Carol, who has been fighting for single payer for decades in New Jersey. So Carol, come on up.
Hello, sisters and brothers. My name is Carol Gay from the New Jersey State Industrial Union Council, and Anna Marner's right. We have been fighting for single-payer health care, now Medicare for All, for 3 decades. And it's wonderful to see such a growing coalition. We have got so many new organizations now fighting for Medicare for All. I also want to say I'm from the Universal Healthcare Coalition and OR Ocean County, and every organization that I'm affiliated with has Medicare for All as a major, major priority. Like I said, the IUC has been fighting all these years. We will not give up the fight. We will not give up the fight because we know this is worth it for all of us. And as people have said before, it's a racial justice issue. It's an economic justice issue. Donald Norcross, you say you believe in economic justice. We cannot have economic justice without Medicare for All. It is a key component of economic justice for everyone in this country. And it is outrageous that we're the richest country in the world and not providing universal health care for everybody in the country. And I'm talking about everybody. As we said before, everybody in, nobody out. Everybody in, nobody out. We want everybody within the borders of this country covered by Medicare for All. And we know that Medicare for All is the only system. It is the only system that will cover everybody, provide affordable, accessible health care for everybody, quality health care, and cut down the cost. The cost of healthcare, as you know, is out of control, totally out of control. The only way we can ever get a handle on the cost is with a Medicare for All system. Thank you. People over profit. People over profit. People over profit. People over profit.
All right, before the last speaker, I just want to mention something that broke news. News broke in New Jersey last week. It was major game-changing news when Frank Pallone last week on Tuesday, March 16, signed on to Medicare for All. First time ever, Medicare for All is on his agenda. He is the chair of Energy and Commerce Committee, one of the most powerful Democrats in the country, and leading the delegation here in New Jersey. So if he can do it, If he can do it, Donald Narcos can do it. If he can do it, Silas can do it. If he can do it, Aldi Osiris, Bill Pascal, and the rest of the New Jersey delegation can do it and should do it. And we are not going to stop until everyone signs on from New Jersey to Medicare for all. All right, last speaker is our newly established county leader in Gloucester County, our Revolution County, our Revolution, Mario DeSantis.
All right, good afternoon. We are here today to tell Donald Norcross that he better clear his schedule every single week, because we are going to have lunch with him and demand that he co-sponsors this new bill. In 2009, at the height of the recession, 8.8 million American workers lost their jobs. Half of those workers lost their employer-sponsored health insurance. The same thing 1 decade later. 35 million American workers lost their jobs. Half lost their employer-sponsored health insurance. Should workers who lose their jobs through no fault of their own also lose their health insurance? The answer is no. The answer is no. It's not just those without health insurance who cannot get the care they need. 1 in 5 experience premiums, deductibles, out-of-pocket expenses too high that they cannot afford the cost. What good is health insurance if you cannot afford the cost? What do we want? When do we want it? What do we want? When do we want it? Everybody in? Thank you.
Okay, so one last time, this is Donald Narcos' tweet from March 17th last week. Let's go, Donald Norcross. Sign on to HR 1976, the Medicare for All Act of 2021. Put actions behind the words. Tweets are nice. School sponsoring is much, much better. Get your name on the bill. All right, everyone. What do we want? Medicare for all. When do we want it? Now. What do we want? Medicare for all. When do we want it? Now. Thank you, everyone, for coming out. We will be back every single week until he signs on.